This general advice video is relevant to both hip and knee replacement surgery. There's no better place to recover after surgery than home, but there's certain goals that need to be achieved before you'll be allowed to leave hospital. You need to know the potential signs of infection to look out for, things such as fever, increasing pain or discharge. They will check your pain is under control and you're happy with what tablets you can take at home. My advice is take the tablets you need to keep feeling comfortable. In that way you'll move more naturally and get better sleep. Ultimately you'll heal and get better quicker. Eat, drink and go to the bathroom. Safely get out of bed, walk with a frame or elbow crutches, and if it's relevant you'll be shown how to use the stairs. They will check you understand how much weight you're allowed to put on your leg, if there's any do's or don'ts, or any positions to avoid. You'll be shown some home exercises to do from the physio, and they'll just check that you're happy with how to do those.